Welcome back to the Health and Wellness Network. I'm Tasia Custodi. Today I'm joined by Dr. Matthew Freedman of Main Street Children's Dentistry and Orthodontics in Naples, Florida. After earning his dental degree, he completed his residency in orthodontics and dental facial orthopedics. Dr. Freedman, thank you so much for joining us today.
Well, thank you very much for having me.
I'd like to get right into the importance of choosing the right orthodontist. What would you say is the best way for parents to pick the right orthodontist for their child?
Well, there's a lot that's going to go into potentially picking the right orthodontist. And like I said, it can be stressful. There's a lot of elements to it. First and foremost, you're going to want to pick somebody who's close to where you are. You know, think about where you work, where your children go to school, what your schedule really is. Imagine most orthodontic visits are going to be within about a 4 to 6 week period every month. Once a month, every month you're going to see the orthodontist. And so it's got to work for you in your life. It's got to work in your schedule. It's got to work in the school schedule and work schedule. You may find orthodontists commonly may have even 2 or 3 locations that you could even go to. So that would be number one. Number two, you're going to want to try to find someone who deals directly with your insurance. If you have insurance, that's going to be an important piece of the puzzle for most families that have insurance. They get it through their job. And an office like ours, and my personal office, we deal directly with the insurance company. So we will submit the claim for you. You only just pay the difference between what the insurance is paying and what the total is. And we deal with the claims and fighting out with the insurance company about getting the money. Otherwise, there are commonly places you'll go where you have to pay the entire amount to the doctor's office, and then you as the patient then need to submit the claim and then fight it out with the insurance company to actually get the money back. So dealing with someone who is not only in-network but takes a direct reimbursement from the insurance company is going to be a big piece of the puzzle for most families nowadays. Most people have dental insurance and commonly some type of orthodontic coverage. Finally, realistically, you want to go somewhere. Picking the right orthodontist, really at some point, as simple as it sounds, involves finding an office that you like. Again, you're going to be seeing these people once a month, and so you want to go somewhere where you like, where you have fun, where you enjoy the orthodontist in the office. It's kid friendly, it's fun, and even as adults, you want to go somewhere where you feel comfortable. So long as people are coming in and out reasonably, you know that when it comes time for your appointments regularly once a month, you're going to be able to get in and out the door within 15, 20 minutes, 30 minutes usually at the most. So,
what types of things should parents avoid or be wary of?
What you really want to be careful of is anything that just sounds just out of the ordinary. You know your child, you generally have a sense of kind of what their teeth sort of look like. Luckily, your teeth are something that you can just have your kid open their mouth and take a peek at. It's not something that's inside your body that you can't sort of see. So, obviously we take x-rays and there's things sometimes that are underneath the surface that maybe you can't see visually. But for the most part, you do generally have a pretty good sense of, how bad your kid's teeth potentially are, how much work you maybe think that there's maybe involved. And commonly we hear from parents who'll see an orthodontist and it just seemed just out of whack, either with how long they were saying it maybe was going to take or how much money it potentially seemed like it was going to cost, or they were offering some, strange plan with some strange appliances or things. There are things that you'll find in the orthodontist office that are just more than just braces. And many times kids need those things, but you really want to make sure that you're at a place where you're getting obviously good treatment, but treatment that seems reasonable. If something seems out of the ordinary or seems odd, we really look at our office as a real family, and everybody in the office likes coming, and we like seeing them. And so I think that's really critical. Also, things to avoid would be, again, places where you potentially may find that some offices may have multiple doctors in the office. In our office, it's great. We have both a pediatric dentist and an orthodontist in each office, which is great because you can kind of bang out all of your appointments all together, kind of kill all the birds with the same stone. But you may find offices where there may be multiple orthodontists. So long as the same orthodontist is seeing you almost, for all of your visits, that's really the critical thing. Orthodontics tends to be something where we're going to see you again once a month, and there's certain expectations with what we're going to be seeing each time you're coming in. If it's a different doctor that's looking at you each time, you may find that one doctor didn't agree with what the other doctor was doing, or may change something that the other doctor kind of was expecting to see. And again, it's a real chess match, and you want the same person playing the game each time.
Now, when it comes to calming the nerves of a child, what new techniques and technologies are available?
New techniques. Our most common thing that we do is what we would sort of call tell, show, do. So we tell the patient what we're going to do, we show the patient what we're going to do, and then we actually do it. So, each step of the way, we're making sure that we're really informing the kid exactly what's going on. We don't want really any surprises. We are not sneaking up on kids anymore. Those are things that cause stress. Those are things that cause anxiety. The fear of the unknown, right? So, we have models of what we're going to do. We have videos of what we're going to do. These are great tools that, 10, 20 years ago we just didn't have. We can show you in your hand and on a computer, what you're expecting to see and how that little appliance may move your teeth around. Those are great tools for kids. Luckily with orthodontics, we're not dealing with needles, we're not dealing with drills. These are not, luckily painful appointments, at the time of when you're actually in the office. Now, you're definitely going to feel some level of some soreness and some pressure and some aching, afterwards for a few days once you come in to get your braces adjusted. But for the most part, putting braces on is a, 20 to 30 minute procedure. These are not terribly difficult things to do. And so luckily we don't deal too much with it. The doctor, again, needs to be someone who is calming, who's confident, who knows what they're doing, who, presents an air of calmness. And it's gotta be, it starts at the top, and it carries through with the assistants. You're gonna be seeing the assistants and the other gals in the office a lot. And so, you want someone who's going to be patient, who's going to take their time. It doesn't seem like they're just rushing through, getting frustrated with your kid. That kind of stuff surprisingly happens a lot, unfortunately. And it always surprises me how many times you mention that to a parent, and they said, "Geez, yeah, I just never really thought of that." And now that I'm here at a different orthodontist, well, yeah, wow, this is really quite a different experience. So, yeah, you want someone who's going to take their time, be patient, especially with younger children. Nowadays in orthodontics, we are doing a certain amount of the work earlier than we used to. We get parents saying all the time, "Well, geez, I remember I got braces when I was 15, 16, and now, yes, sometimes you will see children even as early as 8, 9, 10 that have some level of work that needs to get done. We're recognizing that some of these problems are better off with early intervention, and certain bite issues, certain really severe issues. Now, that's not most patients. Most patients are not going to need something that early. Average age is still going to be about 12 and a half roughly once all your permanent teeth come in. But there are children that need something done early.
So if you could give parents one piece of advice when looking for ortho care for their child, what would it be?
Follow your gut. You know your kid better than anybody. And you want to be somewhere, you want to be seeing someone that you feel good about, that in your gut, you just sort of know that this person knows what they're doing, cares for your child, is going to take the time to answer your questions. Those are critical things, again, like I said, that sometimes get missed. And at the end of the day, you want to be going somewhere where you feel like you're well taken care of, and that the fee seems reasonable. Again, if someone tells you something that just sounds out of whack. Luckily, in orthodontics nowadays, most places, at least we do in my office, offer a complimentary consultation. So, getting a second or a third opinion it really is never a bad thing. Getting more information can never hurt. And you may find that after doing 2 or 3 other consults, that you may go back to the first person. You may say, "Geez, actually, I really like that guy, and actually the fee was pretty reasonable, and what he was really sort of saying actually sounded kind of right after hearing what everybody else had to say. So,
Dr. Freedman, thank you so much for your time today.
thank you very, very much for having me. I hope I was a help.
My guest has been Dr. Matthew Freedman, and you've been watching the Health and Wellness Network.